that this is either a tendinopathy, you've palpated the tendons, they're negative. AC joint, you've palpated the AC joint, that's negative. Basically, it now leaves you with tendinopathies, with labral tear, essentially. So we'll do O'Brien's test. Come in here, adduct it a little. Full medial rotation of the arm, don't let me push it down. Push up, push up, push up. Does that hurt you? Okay. If it did, you're going to turn it over. Laterally rotate the whole arm, don't let me move it. Does that hurt you? Okay. So what we're looking for is pain here and no pain or significantly reduced pain there. That's positive O'Brien's. High chances this is labral. We could have a labral tear with a negative O'Brien. That means that the labral tear, if we find one with a load shift test, isn't the source of the pain under those circumstances. So load shift test. So to take it anterior, we're going to push it straight anterior, anterior and superior, anterior and inferior. Then we're going to look at posterior, posterior, posterior superior, posterior inferior. So to do the anterior one, put your thumb on the back of the humerus and push the humerus forward and then move the arm. So this is a straight anterior one there. We're looking for the clamp. We take it down to that position, push it, pull backwards and push down, and then take it up a little bit higher and push up that way. And we're looking for this clunk. Now, if it didn't clunk, it could be that it's already forwards. So we'll do the posterior shear one, push it into the glenoid and backwards, into the glenoid and upwards, into the glenoid and downwards. And if it had gone forward, you'd feel that reduce. Okay. So positive load shift test is almost certainly a labral tear. Positive O'Brien's with the pain is a positive labral tear. With that as the source of the pain. A negative O'Brien's test means that he may have a labral tear, but it isn't the source of pain. If that's coupled with a positive shift tear, he does have a labral tear that is asymptomatic. Fair enough? Now, sometimes the labral will get caught forwards and stop movement of the joint. What it does is limits elevation if you test it properly. So hold when I bring his arm up, the scapula is going to want to drop down, so I'll hold that up there, come onto it this way, and look at where it's limited. Now don't push this too hard because you can overcome your resistance. God, that's not a lot. There. That ain't a lot at all. Versus here. Okay. And then you follow it up with a posterior glide. Do it with your fingertips this way. And I'm going to push that. There's a big guy, so I'm going to do it one at a time. And I'm basically stabilizing the scapula and just pushing back on the humerus there and comparing the Enfields to that one. And that's not moving. All right. So this is the one we're going to manipulate. Land your back forward. Okay, come to me a bit more. All right, so we're going to do distraction by doing that. So I've got the heel of my hand on his humerus, graded tuberosity there. That hurt?
Oh yeah, just tender.
Okay, just that. Lean back there and thrust posterior there. Oh, I think that went in. Come on up. So we recheck him. Glide first. Let's glide a bit better now. Then this movement. And he's got it. All right. Now, all the tests were negative. Let's just try O'Brien's again. Don't let me move you. That hurt you? Okay. So let's try load shift, which it may have been blocking the load shift test because that's likely to make that negative. So we'll come in this way. And then we'll try and push it back. This maybe he's got so much muscle here. It's like doing the ACL on a big person with lots of muscles. They can be negative. But manipulation works, so he must have a labral tear in there, I would think. Otherwise, that manipulation wouldn't work unless there's a pathology I don't understand, which is very possible. There it goes. That just clamped. All right. You're not getting symptoms in there anyway, eh? No. So it's an asymptomatic problem. Okay.